To me, being a doctor is being put in a position of enormous responsibility. And it's a responsibility of doing the right thing, doing the best, doing 110%, and doing something that society has given us an enormous responsibility to do in the best way we can. I know that when a patient comes to see me, that they're coming with trepidation. So I try and do a few things. Number one, I try and stay on time. Their time is as valuable as my time, and so I try to make sure that my patients don't wait to see me. When I see the patient, I sit beside them. I don't sit in front of them. I let them see the notes that I'm taking. I let them tell their story. When I see a patient who's had a severe head or spinal cord injury, talking to the family is probably as important as talking to the patient. The family's looking for hope, but they're looking for facts. And sometimes we don't know what's going to happen. So I try to tell them, this is where we're at, this is what's happened. It's a delicate balance between being realistic and pragmatic, but also some empathy to know that they're looking for some sort of hope and some sort of way forward with you. I think you've got to at least allow that hope to stay, even in the most difficult situations. But at the same time, you've got to be honest in an empathic way. And there's no easy way to do that. We all have families, and we all know how we'd want our families treated in the same situation, so you try to do the same thing with the families of the patients you look after. Head injuries are devastating at any age. In children, particularly in adolescents, in teenagers who have got the best part of their lives ahead of them, a head injury is sometimes a life-changing event for the worst. And so I saw there was a need for education in terms of prevention of head injuries. And that's why I was so keen to set up a chapter for this national organization here in Reno in northern Nevada. Think first, partnering with Sierra Neurosurgery Group does 1 or 2 helmet giveaways a year. It's a novel idea, and what we want to make sure is if you have a bicycle, you have a helmet. If you have a skateboard, you have a helmet. It's cheaper to give a helmet and stop a head injury than have that same person in our intensive care unit. So as part of our message on good living, prevention, and lifestyle modification, wearing helmets with high-risk activities is mandatory, and by giving those helmets away, we're trying to reinforce that message. My name is Lali Sekhon, and my philosophy is treating my patients the way I would want my family treated.